We have many lessons, from political to coordination of binational efforts with different authorities. And as you know, in addition to the Pan American Health Organization as an international agency, with both the field office here in El Paso and our office in Washington, provide a lot of the technical advice for the project. But also was very critical to have the CDC, not only in terms of the funding, but also to give all the epidemiology and the expertise in diabetes from them. Mexico and the Ministry of Health from Mexico, the Secretary, the Ministry of Health from the US, and the states and the city give a special complexity of this type of survey. Never before in the world has been able to have this unique survey over one of the largest borders of the world. And the lessons go from the methodology part. This is a complex sample with a complex sample design that illustrate very complicated issues for the analysis. And from the political and participation, 130 organizations have been linked to the project, helping and being partners. I think the lessons from the survey and the possibility now that is ending the project and offering the data available for all the public health researchers, I think it's an excellent opportunity for universities and governments to give more in-depth analysis on how to address this problem of diabetes. Remember that diabetes now is so important and is affecting all the areas of healthcare. And we need to tailor interventions that are directed to healthcare interventions, but also environmental and healthy spaces, healthy conditions, healthy schools. We need to promote the healthy conditions for the populations. Policymakers are very concerned about what are the most effective interventions and policies that they could offer to the population. And for this specific survey, we start recognizing that the amount of pre-diabetic population is so large that if we don't have policies and interventions directed towards the pre-diabetic population, will be very difficult to provide services when they become diabetic. One very critical policy and intervention should be to develop these strategies targeted to the pre-diabetic population. Another very important policy and interventions are the ones that will be dealing with child obesity and child nutrition. We know now that diabetes is taking shorter periods of time to become with disease. And if we don't tailor and target children in helping them in their nutrition and in their pattern of exercise, we will complicate with diabetes, but also with hypertension, obesity, and other chronic diseases that are very critical for the new public health.